Swelling in your legs or edema is caused by excess fluid trapped in the body's tissues and can result from various causes. Now, because of gravity, it often starts in the lowest part of your body, the feet, the ankles, and eventually, depending on how severe, all the way up your legs. People lying in bed all day will get edema around their butt or back. Here are some common causes. Top 10. 1. Heart failure. When the heart is unable to pump blood effectively, fluid can accumulate, particularly in the legs and even in the abdomen. 2. Kidney disease. Impaired kidney function can lead to fluid retention, as the kidneys may not filter waste and excess fluid properly. 3. Liver disease. Conditions like cirrhosis can affect the liver's ability to produce proteins called albumin, which causes leaking of the blood vessels by reduced osmotic pressure. And by the way, certain kidney diseases can make you urinate out all the protein and cause a similar problem. That's called nephrotic syndrome. Number 4, venous insufficiency. Damage of the valves in the veins can cause blood to leak back in the legs. We see that fairly often. Number 5, big warning, big, deep vein thrombosis. Hints are that it is more often one-sided and can be painful. Anything from a long trip on a train, recent surgery or trauma, something causing your blood to clot more than the past, like cancer, are significant risk factors. Now, missing this diagnosis can be deadly. I don't want to be an alarmist, but it's true. Deadly. Those clots can break off and travel up into the right side of the heart and into the lung, causing a pulmonary embolism, which again can be deadly. Or in some people who have tiny little holes between the atrium, cross over from the right atrium into the left and then into the brain, causing a devastating stroke. Number 6, medications. Certain drugs that we know, such as calcium channel blockers for blood pressure, particularly nifedipine and amlodipine. But also steroids, and one of my least favorite drugs, those non-steroidal anti-inflammatory drugs, Advil, Motrin, etc., can cause fluid retention. Number 7, dietary factors. High salt intake can lead to increased fluid retention, contributing to edema. Eat at McDonald's every day, and you can get that. Number 8, lymphatic obstruction. Conditions that block what's called lymphatic drainage. It's not true edema, but it looks like it, such as infections or tumors, can lead to swelling in the affected area. That also increases the risk of DVT, by the way. And number 9, obesity. Obesity causes fluid retention and venous disease. Most obese patients will have some edema. 10, cellulitis. Look for a redness, and it often is painful. Very interesting. White blood cell count is elevated, and there's often fever. Never miss this, as it can lead to a life-threatening infection. Understanding the underlying cause is crucial so treatment can be effective. Now, you really want to get this seen right away. Sometimes the best option, if you have a great doctor, they'll see you the next day or the same day. Otherwise, you may be stuck going to the emergency room. I'm not a big fan of urgent cares. Unfortunately, many of them just don't supply the appropriate treatment. And that's your top 10 causes of edema. I hope that helps.